Hey, how you doing? Good morning, good afternoon, good evening. Who knows what it is for you, but here's what we're going to talk about today. I've been doing a lot of reading and a lot of research for a particular patient on iron. And you all think iron, well, yeah, iron. What is iron? Iron, I don't know. But you'd hear it talked about at low levels. When your iron gets too low, did you know you lose energy? Yeah, I didn't think so. We think of it as something that's there, but we don't know that it's used for energy. We also don't know that if you don't have energy, you can't exercise. Well, we know that, but we also think of it as something that you take a tablet for. Well, yeah, you can, but you can also get iron from your foods. Now, I know a lot of you are very self-conscious about eating red meat, so whether it be beef, buffalo, ostrich, those all contain iron, and my camera guy, Scott's, and my favorite way to get iron is liver. Now, Scott likes his with Dijon mustard on it, sauteed, right, Scott? Yum. I kind of like mine with bacon and onions. Yes, I'm a bacon eater, and you should be too. So we need to keep that iron level up. Now, one of the things the body does with the iron on the red molecules, it takes it apart. You see, your body was the first original recycler. And so what it does is when a red blood cell is ready to be sent out of the body, I almost said pooped out, but didn't want to say that on camera. Good thing I didn't. When a body is getting rid of that old dead red blood cell, it takes all of the parts off of it and stores it in different places. And then when a new red blood cell comes out, it puts, so to speak, old parts on it, but they're almost refurbished, kind of in a strange way if you want to look at it that way. When we have enough iron on that red blood cell, we can get so much more done in our day. We have more energy. We think a little bit clearer. We don't get that pasty white look. Have you seen people that are all really, really, really white? And they're usually iron deficient, and they're complaining about a lot of things, and their gums are a little bit whiter. Their tongue is a little bit whiter. They pull down the inside of their eyelid, and that's kind of white too. A lot of those people need iron. You can also get iron from eating vegetables. I know a lot of you are vegetarian, so let's look at some spinach. Anything that's dark green will have a little bit of iron in it. I love the fact that if you're iron deficient, we'll try to eat our way up to iron, but we sometimes need to use a supplement to get some iron in. So if you think that you're struggling along and you're trying to limp it along on your own and see if something makes a big difference for you, it just might be your iron level. And so in order to give you a little bit more iron, that's something that you should see a professional to do, somebody like a naturopath or your doctor. See a naturopath to get your iron levels up. Now, iron is never something you should give yourself without having your levels checked. Too much iron is a bad thing too. Overdosing on iron, you can almost induce cancer, so let's not do that. You need to have an iron level that'll allow your body to function in homeostasis, which is the body's level, big word for the body's level of normal. So don't be afraid to get your red meat in, don't be afraid to get your dark green vegetables in, and don't be afraid to get help if you feel like you fall in any of those categories. So here we are today. I'm Dr. Ray. Come see me today to feel better. Talk to you later. Have a good week.